Good afternoon, everybody, and welcome to what is now episode 5 of a series of interviews in which I am speaking directly to patients who have contacted me independently or have got in touch with me through my private health advice service, essentially concerned that their symptoms have developed since a COVID vaccine administration. But really, the reason for these interviews is to leave this open for the public to judge. And so with no further ado, I'm happy to introduce you to our patient, Sasha, who is on the left, my left facing the screen. And we've got Emma, who is a very good friend of Sasha. She's here to help with her because she's had some cognitive issues since the jab. And so Emma's now her carer as well for most of the time as well, just to introduce that to the audience. So firstly, really, Sasha, I wanted to ask, what was your health like before the vaccine? What was your general health like? Did you have any conditions? Were you on any medical medications?
Yeah, I had a few medical conditions, but on the whole, I mean, my sort of like health was okay-ish. I mean, I had medical conditions like I had heterotopic ossification, which was a bone condition.
You've just had to tell me what that is. So that's like a bone condition where you had to have an elective below knee amputation, or is it above knee amputation?
Above knee. I had that done in 2019 in the September.
Yeah.
Sorry. Emma is going to have to take over. So my words keep on going.
Don't worry.
He was pretty good, very independent.
Yeah.
Very busy. Very, very good all-round person. Fostering dogs, that was Sasha's passion, still is. And
about that.
Yeah.
and so active as well. So was there any medication lists, along the medication list, or were you on any regular medicines or not really?
Yeah, I was on quite a lot of medication, but I was managing it all independently.
Yeah.
And it was all fine. I was able to drive with it and everything like that.
What medication was it for? Was it like pain relief, or was it for systemic medical problems?
It was all pain relief. Yeah.
Okay. So in terms of your general health, then really it was more for pain relief from the surgery.
Yeah.
Okay. So I mean, your story is slightly different to some of the interviews I've done so far, in that you actually got on well, didn't you, in the COVID era, as it were, with what you were told was COVID, or what you were tested for and was positive for COVID. You were in hospital for some time. You can tell us a little bit about that, actually, how you were in that. So.
I was ill, first of all, at home, with what we thought was COVID. I mean, I was poorly for about a week to nearly 10 days to 2 weeks or so, at home. I wouldn't let anyone near me because I thought it was a bit like COVID, whereas I, had a temperature and, I felt very unwell and everything. But all of the tests were negative. So, but I didn't want my mum catching it, so everybody else was not allowed in, until my GP took one look at me and said, "You're going to hospital." But I kind of that was the one time that I kind of agreed with him.
Yeah. And the clinical picture was that of a respiratory tract illness, essentially. Coughing.
It was the dry cough. I had quite a dry cough. I was very I had a quite high temperature. I was really quite disorientated in a way.
And you'd said up until the admission you had tested yourself at home and there were negative tests. Yeah. When did the actual positive COVID test come? Was that in hospital with a PCR test? Or?
No, so I'm going to just take over here because Sasha doesn't actually remember the hospital stay at all, which is quite, in a way, quite good. So they kept testing her and testing. It was about 7 days in the hospital stay that she actually tested positive. Up until then, it was just negative, but the doctors there kept saying she had something called COVID lung, and that's how they knew she had COVID. And she also ended up with neutropenic sepsis and COVID pneumonia, and was in hospital for just over 3 weeks in total. And they kept testing her, and with I think I'm presuming lateral flow tests, and the day that it came back negative is the day they discharged her, which was a Wednesday.
So they tested and tested and tested and tested and tested until they got the positive, because it fitted in with the clinical jigsaw puzzle of COVID, essentially. And to cut a long story short, she was in for a certain amount of time, wasn't she? Quite 2 or 3 weeks, did you say?
Just over 3 weeks,
3 weeks, and then discharged. And before that, you never had any lung problems? We covered at the start, really. You weren't somebody who smoked or had asthma or COPD?
I used to smoke, but I'd given up 10, 15 years ago. So I'd never had any kind of, lung condition or chest infections or anything like that. So I didn't know, I'm not, that I felt like somebody was sitting on my chest.
Yeah. And since recovering from it, I mean, have you had any chest issues specifically?
No, not really. I do occasionally have a weird cough, but I don't tell anybody about it.
We knew that recovering from something like sepsis was going to be a long road. It was not going to be something that was going to happen overnight. So that's why I moved in with her. I just rang the boyfriend at work and said, I'll see you when I see you. And this was end of May 2020, beginning of June, and he hasn't got rid of me since. So unfortunately,
you have literally moved in. You're paying rent there?
Yeah, I did. It's a 1-bedroom flat, and I just slept on a block bed because I knew that there was a need, because you're sending home a disabled person who's in a wheelchair, who lives on her own. I just thought she's going to end up back in that hospital, and I knew that if she went back in, she was going to come out in a box, and I can't lose my best friend. So it was that, or it was lose her or move in. So it was a no-brainer for me, choice wise.
We all need friends. We all need friends like Emma, really, don't we?
Oh,
so take me forward in time. So you've recovered, you're back home, your friends moved in, and things are going okay. And you were due some surgery, I believe, from what you told me. You were due some surgery in the next few weeks.
Yeah, I needed some surgery. I think we're in 2021, and I'm doing okay.
She was doing really well with her recovery.
Right.
There were no issues, bar a little bit of tiredness after overexertion, but she was up and out. We were out doing stuff. She was doing so well. I'd done research with nutritionists and dietitians to try and find the best diet and supplements to support Sasha in her recovery, and she was just doing amazing. And then she needed the surgery.
So essentially, you're a COVID recovered patient, according to the eventual positive test. So you survived the Black Plague of COVID. You're one of the survivors. And then you're sat in an outpatients department, seeing a surgeon. And this is where the topic, just to introduce the topic of the first COVID vaccine, came into the mix. So just recently recovered from a COVID hospitalisation, natural immunity pumping through your system, and then this doctor called you out on getting a vaccine.
The surgeon said to me, I want you to be as COVID safe as possible. I would like you to have the COVID vaccine.
Right. So the surgeon showing his immunological understanding there by offering you a COVID vaccine after, and it's fairly. What was the time frame between that appointment and you actually having this first positive COVID test? Was it weeks or months?
Months, like 10 months.
Okay. So the 10 months had elapsed. Okay, so a bit of time had elapsed, but we're still talking about natural immunity being at work. So okay, so you had the first vaccine because you needed it for the surgery. Essentially, is what was said. I think when we first spoke, it was almost, well, we'll call it what it is. It was coercion. I think they said to you. I mean, you please tell the story. Did they say that they weren't going to proceed with the surgery unless
I felt that it was said that, you know, that it was pretty much, if you don't have the vaccine, you don't have the surgery.
The words were, because I questioned, I said, well, she's already had COVID, so she's got natural immunity. And we were told, because I was there at the appointment, of well, if she wants this surgery, she needs to be as COVID safe as possible, so therefore she needs the vaccine.
Okay.
And I did outside express my concern to Sasha, but ultimately, body autonomy, it's Sasha's decision. And whatever her decision is, as her friend, I support her. She can listen to my opinion, but ultimately it's her body. And we women have fought for body autonomy for years and decades and centuries. And I hold by that as a woman, that this is Sasha's body, whatever she wants done to it. If that's what she feels is right, I just stand there and go, okay, I'm with you.
Well, it's not only coercion, but it's just not relevant to the surgery either, whether you've got COVID, you know, immunity or not. It's not relevant to that decision. So you took this vaccine under the coercion of your surgeon, and run me through events. So I'm just going to hand over the mic, Sasha, to you. What happened? Because you had quite a quick response to it, didn't you? You had quite a quick adverse event.
I had the vaccine, and I'm going to have to hand it over to Emma, because I'm sorry, I don't actually remember it. It was quite a quick response, and I'm sorry if I get upset, but
Oh, bless you, Sasha. Take your time.
I don't remember.
So we were told to go to a local medical centre. I drove her there. I was not allowed in. Absolutely fine. Sasha's very independent. She cracked on. I just asked, I just need to know the exact time, whether it's, you know, 1 minute past 12 or whatever. Just, I need to know the exact time. So if there are any responses from your body, I can then monitor them. She had the vaccine dead on midday, and at exactly 4 o'clock that afternoon, she started exhibiting symptoms. So she got a sky high temperature. Her body started to swell. And I mean, visibly, it was visual to me that she was swelling. Her skin turned bright red. She started complaining that she had the most, like a pickaxe migraine. She was sort of like shaking, but she doesn't remember any of it. Which in a way I'm quite grateful for, because
when you say doesn't remember, do you mean like delirious?
Yeah, she's lost 3 weeks of her life
at all. I have no recollection.
So it's literally like those 3 weeks have been chopped out of your biography.
I just don't remember.
I remember thinking to myself, do I dial 999 or do I just try and nurse her at home? I have no nursing background, just your average J person in the street. And I thought, no, I need to keep her at home, because she doesn't like her local hospital. And unless she's got a limb hanging off, she won't go to that hospital. So I kept her at home. I don't know if that was the right choice. I will never know that. But she's saying yes. But I felt that was the right decision for Sasha. So I just nursed her at home. And we then called up her doctor. We went to see her GP. I asked for every single symptom to be written down, and I asked for her to be referred to an allergy vaccine specialist, which we were. And he told us that it was just the vaccine working. That the reactions don't happen within 4 hours. It takes it happens instantly.
Don't be silly.
Don't be silly. No, it's not a that's not a reaction.
It's not a reaction. That's just the vaccine working.
Right.
Ultimate
gaslighting. I mean, ultimately, look, you know, you've got these physical symptoms almost erring on the side of anaphylaxis here, and it's just normal reaction to a vaccine. I mean, it's not even a vaccine, as we've discussed, but
no, it's medical therapy or whatever you want to call it, but it is not a vaccine in my book. And so she had the second one, and exactly.
So take me through that. So you've had a reaction to the first one. How was that dealt with? Was that your independent decision to take the next one after having such a severe reaction, or was that more to do with coercion or the doctors haranguing you to take it, or a bit of both?
That was basically the surgeons saying, Well, if you don't have it, you don't have the surgery.
The same
You
again.
had
So
to have two. Yeah,
I had
it
to
was
have two.
back to that same principle of, you're not having the
Yeah.
surgery unless you're
I,
COVID
I, had,
safe.
I had to have two. That's
Right.
what they say.
And did they, I mean, in that interim period, did they know about the reaction? Did they push you to have the second one despite having a reaction to the first? Okay.
Yeah.
Yeah.
So again, just very strange goings on that I hear all the time of, if I give somebody a peanut and they swell up and I have to give them adrenaline, I certainly won't be giving them a peanut again. But the times
No.
I'm hearing about people who've had an AstraZeneca reaction or a Pfizer vaccine reaction being harangued to have the same brand, not even an alternate brand, it's just it beggars belief, really. So you had the second one. Run me through that again. Was that medical centre? Was that
Yeah, exactly the same place, everything exactly the same. I think the reaction time this time was about 2.5, 3 hours. I was prepared. And again, another 3 weeks gone of her life that she doesn't remember, where she had sky high temperature, swelling, the headache, the itchiness, like she was trying to scratch her skin raw.
I remember that. I remember the itchiness because it was like ants crawling all over me, and it was, I was literally wanted to peel my skin off.
Yeah.
And it was awful.
And this time round, did you get any medical help? Did you go to the GP again or thought better of it?
Because it did not feel that the GP would have listened. I kind of got the impression that they really didn't think that we were serious, that it was just an exaggeration over the symptoms. So I just thought, what's the point? I nursed her again at home because I knew I could do it the first time. If she'd exhibited anything more serious, like seizures or something like that, I would have blue lighted her myself straight in there. But because there was nothing like that, I just thought I can do this at home. I'll keep her safe at home. And that's what I did.
But there's an important point in there, Emma. Obviously, you've been gaslit there in the first instance after the first one. So you've lost trust to the point where you're unwilling to, not in every circumstance, but you've got, concerns about going to hospital and revisiting that GP who has essentially dismissed it as just a normal reaction. I mean, it doesn't sound, I wasn't there, but it doesn't sound like a normal reaction to even a normal conventional vaccine, really, that level of immune response to it. So just kind of, if you can summarize, Sasha or Emma, really, how have you been left? I mean, you had these three-week periods of kind of like just lost your biography, cognitive, you've gone into detail about that. How has it left you in terms of symptoms now as we speak in February 2024?
I still have a lot of word problems and finding words. I still have a lot of brain fogginess and everything. That's a big thing. I have a lot of migraines to the point where that's been treated now with, they put Botox in my head, which I don't get wrinkles now. It's lovely.
One of the benefits.
That's lovely.
I think if you look on the NHS website and you read the COVID vaccine reaction list of all the things that you can get with a reaction, the only thing that Sasha didn't have was seizures, and she still has everything else on that list.
And what brands did she have? What brands did she have?
She had AstraZeneca.
And they gave her AstraZeneca the second time as well after the first, so they didn't change up the brand even after the two. So it's mainly cognitive issues. And have you had any investigations, Sasha, about this? Have you had any scans of your head? Have they found any hard pathology or actual organic findings?
I had a scan. When did I have this?
So she had a brain scan in February 21, so that was pre the vaccine. We're hoping to get hold of another one so that we can see and compare, because there's one before, we'd like one after. No, nobody has offered us any help. We have raised it, but it's very dismissive, and they just want to put her symptoms down to long COVID or post-viral syndrome rather than the actual vaccine, because nobody wants to acknowledge in the general medical field that the vaccine is doing this to people.
But have medics actually postulated this is more likely long COVID than it is to be vaccine, despite that very
That's the only offer they, oh, well, it's long COVID, isn't it? We don't really know much about long COVID. So
have they even referred you to long COVID clinic or anyone that can...
But I've not heard, I've not spoken.
Yeah, you'll be waiting for 3 years for that service, I think.
Well, I'm in a long
a long COVID clinic, but we've not had any contact with them for about 18 months because
I was always long COVID and never the vaccine, as they say, really, as the elephant marches through the room blowing its trunk. So just finally, I mean, yeah, so no one's equated this to the vaccine at all. It's not come into any conversations.
We know, but no medical personnel is willing to speak up and go, I agree with you.
And what's your opinion on that? Why would they not speak up? What do you think? What's stopping them?
I'm a fully paid member of the Tinfoil Hat Brigade, so I know what the problem is, but I'm going to leave this one to Sasha because this is Sasha's story, not mine. Why do you think that nobody's acknowledging why you're vaccine injured?
I think they're afraid. I think they're afraid of losing their job, or I think they're afraid of not if they speak up, they're gonna lose what's the word? Their peers' respect and stuff like that. And whereas I think that actually, I think the absolute opposite, if they actually did speak up, I think they might earn some respect from people.
Absolutely, and that time is well past now, isn't it, really, in terms of... So I mean, going back to yourself now, your current position, were you working before and now you're not working? Or
no, I wasn't working, but I mean, I would love to go back to do my fostering of my dog.
Is that you behind? Is that you behind you with the dog?
Yes.
That is you. So how long ago was that? That picture?
That's my dog, and they're both my dogs.
Are they recent pictures though?
Yeah.
That was 21. 22. Those photos were 22.
So there's a significant change in how you look between those two pictures. That's the reason I mentioned it. Really, it looks almost like a different person. If you forgive me for saying, really.
That's all right.
I'm sorry this has happened to you. Really, I am, and I keep apologising at the end of these interviews that, you know, the gaslighting and the links to the obvious. And I know just to finish off, really, I know we talked off camera just about the vaccine damage payment scheme. Have you considered that, or I guess
I didn't know anything about it.
I'd not mentioned it to Sasha because I didn't know the criteria. I also know that you need a lot of information to try. I've seen, I can't remember, I feel awful, the children's psychologist at Great Ormond Street, his wife, Charlotte, I know, has battled to try and get payments, and he passed away. And I kind of, there's this sort of level of, okay, I know Sasha hasn't died, but she's injured and something would make a difference. But I've also seen the battle that Charlotte has gone to try and get some form of recognition. And I just think, I don't know if Sasha's got the strength for that. So it's down to Sasha whether she wants to.
This is the thing, though, Emma, isn't it? It's like, it's not only the fact that again, all the stories that I've heard so far have all explained that exact thing, the battle to get it, and then to other people think considering that action to get some compensation are put off by it, because it's like the doctors when they say to me, oh, we don't really want to speak out because I've seen what they've done to you, and you know, it's almost prohibitive really in that respect. So it's never going to truly reflect the true you know, magnitude of vaccine injuries, because people aren't applying because they don't want all the stress, and when they do apply, I mean, the chap I spoke to this morning is on to his third appeal and he's clearly vaccine injured. So I mean, this is last and final question really, Sasha. Has this ever been penned on mental health? Have you been filed under functional neurological disorder? Has that been used yet, do you know, or have they tried to offer you antidepressants?
No, when I had had a memory test, and they seemed to say that it wasn't anything to do with my memory. It was due to the fact that I'm more something or
So
another.
she had a memory test. No functional neurological disorder has not been mentioned. No, she's not been offered antidepressants because she ain't depressed. She never has been, never will be. But the memory clinic basically said she didn't put in enough effort, so they couldn't decide whether or not she had got a memory, because whether or not she had a memory problem. Because
right. But I was in there for 3 hours.
Yeah,
that was all they've offered. Is
3
that
hours.
the only reason I
But
mention
no.
that is, again, I keep hearing that story that people are going in with this wide range of symptoms doesn't really fit into a diagnostic criteria or pigeonhole of a condition, and so then people are then sort of gaslit into it being up in the head, really. So I think we can file this case really well and truly under medical mystery. The doctors are baffled, but it's absolutely nothing to do with the vaccine, of course. So
Nothing to do with it.
No.
Nothing at all.
Never.
Conscious of the time now, so I just want to say thank you both ever so much for your
Thank you very
time.
much,
Thank
sir.
you for your bravery to speak out as well, and good luck with everything. And you know where I am if you need me.
Thanks very much, David. Bye bye.
All right, you take care of yourselves. Bye. Bye.
Bye.